Hi, this is David Swan, Senior Consultant with MTM Services, with a few pieces of information about telehealth. The coronavirus, also known as COVID-19, has changed America and the world, and in particular, healthcare workers, and I include behavioral healthcare providers in that category, are vulnerable to exposure and transmission of the virus when we have contact with others in the work settings that we're often found in. As a result, many organizations nationally have rapidly accelerated the use of telehealth, and some have transitioned all of their services into telehealth in just a matter of days. MTM Services has helped some of them, and we are incredibly proud and congratulate them for doing so. We've received many questions from providers across the nation as a result, and one stuck out to me in the past couple of days. That is how to manage a crisis situation when telehealth is the method by which treatment is provided. So telehealth is new to many professionals and also to our clients. Still, there are a good number of behavioral health delivery providers that use telehealth as the only method of treatment. Several of these national providers report over 1 million active recipients of care. Preparing clients is the key. As professionals, we often think that we need to prepare the professionals instead, and that becomes our top priority. Let me remind us all that our clients need to be prepared in the use of telehealth. And we found that if we do that clients tend to like telehealth and actually prefer it oftentimes over in-person care. So to prepare clients and staff to better manage crisis situations, the organization will first want to have some policy procedures to guide the staff in their approach to use telehealth. The policy drafter should consider several different scenarios that allow them to write guidance on how to respond. Some other thoughtful preparations that we can recommend at MTM are as follows that should be discussed with each client at the first encounter and periodically thereafter while having telehealth services. The use of a crisis plan or advanced directives is one of those things that we can use to outline a plan with the client and participating with the client when a crisis might occur. So advanced directives are one of those recommendations that we use. Secondly, we could use hosted telehealth services for certain people, maybe those that are prone to crisis events. Maybe that's where a case manager, a care coordinator, a peer support specialist, or somebody else affiliated with the organization may be with the client while telehealth is being delivered and provided and received. In that case, again, you would want to introduce that host and inform the client of the purpose of that host. Use of DocuSign as a way to, as a technology that allows clients to grant both consent to treatment, approving treatment plans, consenting to releases of information, and authorizations for treatment all may be a way to give clients the power to be able to authorize treatment and to ask for treatment from their own location or wherever they might be at. Designing treatment to prevent crisis events whenever possible by using data to predict any conditions that may precipitate a crisis. For example, scheduling the services via telehealth in anticipation of prevention at a time and a date that is client-driven rather than organizational-driven may be best to avert a crisis. In advance, you could also obtain permission to contact a family member, a neighbor, or a friend of the person, and having that person to be available and that you could call that person to intervene if that was needed for the person. Having 1 to 3 people available to the client that you know about through the electronic health record with contact information may be a good way to be able to call in somebody that could respond rather quickly to this person. If your community is fortunate enough to have a mobile crisis team, they could provide a crisis visit using the CDC required guidance to mitigate risk to the client and to the staff member that's involved. That would be another intervention that could be utilized. And finally, there may be other creative ideas to offer additional safeguards for your clients in your local community that I may not be aware of. As a final recommendation though, calling the emergency response number 911 could be a helpful intervention when no other option is available. We want to help you to deliver good care via telehealth. We understand this is a cultural and a professional challenge for all of us. Good luck as you do this, and let us know at MTM if we can help further. Thank you.